Percussion, in the world of medicine, is like tapping on a wall to find a stud. It helps us understand what's happening inside the body. By listening to the sounds created, doctors can gather clues about the size, shape, and position of organs. It's a simple technique with profound implications for diagnosis. Imagine a drum. Different parts of the drum create different sounds when you strike them. Our bodies are similar. Air-filled organs like the lungs produce a resonant sound, while denser organs like the liver produce a dull thud. Percussion is all about interpreting these sounds. It's a skill honed through practice and experience. Doctors use this technique alongside other diagnostic tools to paint a complete picture of your health. Have you ever wondered how doctors figure out what's going on inside your body just by listening? Percussion is one of those amazing techniques that helps them do just that. Stay tuned as we delve into the specifics of this fascinating diagnostic tool. Lung percussion is like listening to a symphony of breath. Doctors use this technique to assess the condition of your lungs. The process involves placing one hand flat on your chest and tapping it with the fingers of the other hand. Healthy lungs, filled with air, produce a resonant sound, like a drum with its head loosely stretched. It's a clear, hollow sound that indicates proper airflow. However, if the lungs are filled with fluid, like in pneumonia, the sound becomes dull, like a drum with a heavy, wet cloth on top. The resonance is lost, replaced by a thudding sound. Abnormal sounds during lung percussion can signal a variety of conditions. These include fluid in the lungs, air in the chest cavity, or even lung collapse. Each condition produces a unique percussion note, providing valuable clues for diagnosis. Remember, percussion is just one piece of the puzzle. Doctors combine it with other tests like listening with a stethoscope and X-rays to confirm their suspicions. Cardiac percussion, while less common than other types of percussion, can still provide valuable information about the heart's size and position. It's a subtle art, requiring a trained ear and a gentle touch. Doctors use percussion to define the borders of the heart. By tapping lightly on the chest, they can determine where the heart's dullness begins and ends. This helps them assess if the heart is enlarged, which can be a sign of heart failure or other cardiac conditions. However, cardiac percussion has its limitations. It's not as precise as other imaging techniques, like echocardiograms, which provide detailed images of the heart's structure and function. Despite its limitations, cardiac percussion remains a valuable tool in the hands of a skilled clinician. It can provide quick bedside information about the heart, guiding further investigation and management. Section 4. Percussion of the abdomen. Liver, spleen, and kidneys. Moving down to the abdomen, percussion plays a vital role in assessing the size and condition of organs like the liver, spleen, and kidneys. Each organ produces a characteristic sound when percussed, offering clues about its health. The liver, located on the right side of the abdomen, normally produces a dull sound when percussed. This is because it's a dense organ packed with cells. An enlarged liver, often a sign of liver disease, produces a dull sound over a wider area. The spleen, situated on the left side, is usually hidden behind the ribs. However, an enlarged spleen, which can occur with infections like mononucleosis, can be detected by percussion. It produces a dull sound when percussed below the left rib cage. Kidney percussion, while not always routinely performed, can help detect kidney enlargement or tenderness. Doctors tap gently on the back over the kidney area. Pain on percussion can indicate kidney infection or inflammation. Section 5. Percussion sounds, a symphony of health and disease. Understanding the different sounds produced during percussion is crucial for accurate interpretation. These sounds, like notes in a musical scale, can tell us a lot about the condition of the underlying organs. Resonance. The sound produced by air-filled structures like the lungs is characterized by a clear, hollow tone. It's like tapping on an empty drum. Dullness, on the other hand, is a thudding sound produced by dense organs like the liver or a fluid-filled pleural space. Hyperresonance, a louder and lower-pitched sound than resonance, can indicate an overinflation of the lungs, as seen in emphysema. Tympany, a drum-like sound, is typically heard over air-filled structures like the stomach. By recognizing these different percussion sounds, doctors can gather valuable information about the size, consistency, and position of internal organs, aiding in the diagnosis of various conditions. Section 6. Mastering percussion. A blend of skill, comfort, and context. Mastering the art of percussion takes practice, a gentle touch, and a keen ear. It's not just about tapping. It's about feeling the vibrations, listening attentively, and interpreting the sounds in the context of the patient's overall clinical picture. Patient comfort is paramount during percussion. Doctors must explain the procedure, ensuring the patient is relaxed, as muscle tension can alter the percussion notes. The examining room should be quiet to allow for optimal sound transmission. While percussion is a valuable diagnostic tool, it's important to remember that it's just one piece of the puzzle. Doctors correlate percussion findings with other diagnostic tests, like auscultation, listening with a stethoscope, imaging studies, and laboratory tests, to arrive at a definitive diagnosis. In conclusion, percussion, despite its seeming simplicity, is a powerful tool in the hands of a skilled clinician. By mastering this technique and integrating it with other diagnostic modalities, doctors can unlock the secrets hidden within our bodies, paving the way for accurate diagnosis and effective treatment.